waterfalls and waterways are second to none. Said to be the highest point in Nigeria, Mambila Plateau is the home of the largest hydroelectricity project in West Africa. Mambila Plateau, a virgin beauty waiting to be exploited for tourism.
Have you been thinking about coming to Nigeria? Then what are you waiting for? Come share in our wealth of vast resources. Come discover treasure. Come to where there's lots of business opportunities. Nigeria, my nation, my pride.
24 hours a day, 7 days a week. You can watch NTA International live on your TV, computer, iPad, tablet and phone. Log on to visiontv.co.uk and click on Entertainment, then NTAI. You can also download the iOS or Android app on your mobile devices to watch NTA International on the go, anywhere in the world. NTA International.
Hello and welcome to the news update on NTA International. I'm Naja Atutejani. The Nigeria Center for Disease Control has announced 4 new cases of COVID-19 reported in Nigeria, 3 in Osun State and 1 in Ogun State. As at 11:15 a.m. 31st March, there are now 135 confirmed cases of COVID-19 reported in Nigeria, with 2 deaths. Meanwhile, the global coronavirus cases are currently put at 787,438. Total deaths, 37,846, while 160,935 patients have recovered. The global active cases stand at 583,657. Let's now join Onengie Findface, who is standing by at Kurudu Satellite Town for a situation report on the total lockdown in the FCT. How is the situation where you are, Onengie?
Is our satellite town here in the FCT. The town connects Orozo to Karachi area, and then on the left side of the town you go towards Pegi, Jikoi, Garu, and then to Yanya. Now, despite the lockdown order, the Kurudu road is busy with motorists, with tricycles and motorbikes still plying this route. Some are coming from the Karachi axis, others are going towards the Jikoi Yanya axis. So it's not clear whether residents in this environment are adhering strictly to the stay-at-home order. And then I can't tell for now how far they get to before they are intercepted by operatives of security agencies who are enforcing the stay-at-home order.
Thank you, Anenge. We'll keep you updated. Now, the Food and Agriculture Organization has described the outbreak of COVID-19 as a threat to global food security. A statement by the Director General of the Food and Agriculture Organization, Koo Dong-gyu, notes that restrictions of movement as well as basic aversion behavior by workers may impede farmers from farming and stop food processing. The UN agency therefore calls for globally coordinated and coherent response to prevent the public health crisis from triggering a food crisis in which people cannot find or afford food. In the meantime, President Rice Farmers Association of Nigeria, Aminu Gorenyo, says farmers in Nigeria say that they produce enough that will be sufficient to take care of the country's demand during the lockdown period. The coronavirus has claimed the life of another prominent African leader, a former president of the Republic of Congo, Jacques Yombi Opango. Opango had been ill before contracting the deadly virus in France. The former president died on Monday, March 30th, at the age of 81, according to Andalou agency. Opango was an army officer who became the Republic of Congo's first general and served as its head of state from 1977 to 1979. And that's the summary of some of the top stories. Thanks for joining us. I'm Naja Atutijani.
The will that holds society together rolls on the collective purpose of the people to achieve relative peace, advancement, security, and development. Sometimes this will meets an unexpected bump on the road. This then makes politicking, debates on economic concepts, and verbal jousting on the floor of the legislative chamber pale to a clear and present danger, a pandemic which challenges the if and the must around man's most important role, which is survival. Today on Political Update, we will attempt to navigate the maze of governing or administering in a period which has raised more questions than answers on man's full understanding of his environment. In Lagos and Abuja, it is a lockdown, but how are other states also faring? We will look at all these and the next and crucial fortnight in the nation. This is Political Update on the NTA. I'm Fisayo Ogunfuyi. Welcome. Nigeria has recorded a second death from the coronavirus pandemic. Minister of Health, Dr. Usagi Ehanire, confirmed this at a media briefing in Abuja by the Presidential Task Force on COVID-19 in Abuja. NTA's Mitari was there and brought back this report.
With this briefing came an update on the COVID-19 pandemic.
Sadly, another fatality was recorded over the weekend in the person of a patient who had severe underlying illnesses. In addition to the well-known advisory, I am recommending that all families be aware that the elderly among them are the most vulnerable and should be specially protected from needless contact with children and persons who could be positive for the coronavirus infection. The same should be said for all persons who are known to have underlying diseases such as tuberculosis, HIV, cancer.
Chairman of the Presidential Task Force and Secretary to the Government of the Federation, Boss Mustafa, appealed to Nigerians to cooperate fully with the 24-hour lockdown in Abuja as well as Lagos and Ogun states, as announced by President Muhammadu Buhari.
It's a total lockdown, except for essential services, except you are going to access specific needs like medical needs, except you're going out to buy food. Nothing would happen to us if we lock down for these 2 weeks and allow for the tracking of those that have been in contact with those infected.
The task force said steps are already being taken to roll out the palliatives announced by Mr. President.
Mr. President's speech on paragraph 54, he has also directed that the conditional cash transfers be given in advance of 2 months. This we have also called the program heads, and we have directed that we start immediate payment of this cash transfer to the most poorest and vulnerable households in our country.
We have deployed about 7,000 of the registered environmental professionals of Nigeria. They are already in the process of disinfecting, decontaminating, advocacy across the country.
In the coming days, Nigeria hopes to expand its present capacity of 6 testing laboratories and 30,000 test kits to combat the coronavirus pandemic. In Abuja, Mitaire Ikben, NTA News.
Now to the actualities of the situation. As the 14-day lockdown in Abuja commences, petrol stations are amongst the essential service providers expected to operate. Our reporter Lydia Sampson went round some fueling stations earlier and gave us this update.
Studio, we're at one of the petrol stations in Gudu, in the Federal Capital Territory, and we were told earlier by a medical practitioner who is on his way to Kefi that it is indeed relieving to know that petrol stations are essential service providers, and knowing that they are here makes it easy. And of course, we are told that compliance within the FCT is not an issue, but where perhaps the issue will be is outside the metropolis and even states.
With the petrol people, they are not supposed to shut down.
Yes, so how do you feel knowing that they are here?
It makes the work easy for us. Yes, when we are sure that we can access petrol, the movement becomes easy for us.
Coronavirus now skiners of big people.
Who told you that?
Eh?
Who told you that?
Because you never catch any poor man, madam. That is why they say this one now for big man people.
No, it's not like that. Coronavirus can catch anybody, and that's why you need to be careful. Okay. So, and did you people have masks in this place before?
Yes. You don't finish. You don't finish.
It's finished.
Yeah,
then you need to get some more.
Okay,
Thank you, studio. Before I hand over, I'm sure you've heard from Suleiman Bala, who believes that coronavirus only attacks the rich and powerful, and so they can go on with their life. I believe we need to do more as per sensitization, which I know NTA is already doing. So please, let's remind everyone out there that indeed coronavirus is real. We'll keep you updated even as the situations continue to unfold.
Thank you, Lydia. Joining us is Abedon Adeni, Associate Professor and HOD Mass Communication Based University. He's a regular on the show. Let's first ask about the reality of the situation. Did you get here very smoothly, or were there stops on the road?
It wasn't a problem, really, because I had a purpose for coming out. And I think I only had one check. A policeman, asked me questions, and I responded, and he permitted me to proceed.
There's still, even at the Federal Capital Territory, we still have citizens who are saying this is a discriminatory virus. It's about the rich and not the poor. Have we not done enough in terms of sensitization, or is it just a mindset?
That's still a very fatal myth, on the part of sections of the society, and that's what we're saying, that sensitization, awareness, conscientization can never be too much. And that's why we also need to advise that, efforts shouldn't just be towards decorative towards managing patients. We also have to increase effort in the area of prevention. And one effort that we can happen in the area of prevention is sensitization. Because we shouldn't just leave it at the level of information dissemination. There should also be communication, telling people the implications of being die-hearted with their beliefs. Thinking that it's an ailment that afflicts only the elites. And before we even talk about moving into the conversation aspect of it, these societal beliefs is still a problem on the part of our people. And of course, we know that those who lack this understanding are a majority in our system, and we don't want this to continue really. Which is why we're saying that all the funds being gathered so far, all the contributions that we are getting from government, from public spirited individuals, shouldn't just be about isolation centers, shouldn't just be about managing about kids, about PPE and all of that. We also need to pay more attention to sensitization, because it's very critical. The disease has no cure just yet. The best we can do is at the level of prevention, and prevention can be effective if education, sensitization, broadening of understanding around the pandemic, is increased. Not anything about papering a kind of, not something that we can just think we can paper over. It should actually be deep-seated. So we need more sensitization. Yes, we are doing our best. The traditional media, they're doing their best, as it were. Social media, of course, we expect these, various dissemination of false information, conflicting information, and all of that. We expect it, but we understand them, which is why, again, media literacy is very critical, not just on an overall scale, but at this time, where we have a grave disease, that is threatening humanity, as it were.
Now, when you look at it from the political sphere, would you say there has been greater collaboration amongst parties, among political figures, in making sure that the people are conscientized and not being used as an opportunity for cheap below-the-belt shots when efforts are, all hands must be on deck at this point?
That's right. So far, it's been so good. But it's not to say that we cannot still do more, And of course, we also know that we cannot be talking about progress at the level of economics, education, or even politicking if we are not in good health, So health is primary. It's like the infrastructure around which all other proverbial superstructure rest upon in the circumstance that we are in. So, it's just human, that we concentrate, that our focus should be on getting well in the first instance before we begin to talk about every other thing. And even in advanced countries, everywhere else, we see people, diminishing the dividers, diminishing their classifier, the area they are in social classification, and coming together as one to provide solution to the crisis that we have at hand. So it just behoves on us, to concentrate on providing solutions to dealing with it. And of course, we see this reflected in the involvement of public-spirited individuals. Sacrifices are being made, so much billions are being donated, and I see this continuing really. We see donations in cash and in kind, and I see this continuing, which is the hallmark of our own society, because we are much more communal than being individual, as it can happen in some other systems.
I'll still come back to the local response, galvanizing the citizenry, and also the leadership role that top political figures can play. But let's look at it from the global perspective. In terms of, where the politics of the world has gone in the past decade, would you support the position that the so-called world powers, with all the technological abilities, research abilities, and funds that have been voted, perhaps did not envisage to have something like this, because it has caught everybody unawares? Just a couple of months ago, if I recall, it was verbal jousting in the press between Iran and the US. Now, everybody is back home trying to secure their territories. Shouldn't we be putting more effort in research, especially into medical research, than into armaments, for instance, and uranium enrichment and all that? I'm talking about it from the global politics perspective. Now we have a crisis in our hands. We are all facing only one, COVID-19, and at the moment it seems as if globally the world is losing.
Yeah, absolutely, Fisayo. But I think it's only God Almighty that sees everything that is coming ahead of humanity. Try as you may, no matter how brilliant you are as a scientist or as a professional, professional, it's impossible to envisage all situations that will come at you in the future. And do not forget that even the medical science that we're talking about has actually advanced over the age, over the age. And advancement comes most of the time through new discoveries, and discovery is not just at the level of technology, but when you see a new form of disease, which is also very difficult to predict, Like I said, only the creator knows everything ahead, So sometimes it is very difficult, to envisage some of these things, It is impossible for you not to be caught unawares in some circumstances. And what happens is you quickly get back to the drawing board, do your research and find ways of managing it, if not eliminating it. We have seen previous plagues, we have seen previous epidemics in the past, recent ones in the 19th century, the Spanish flu, 1918 to 1920. We saw HIV/AIDS. When it came, it shook humanity. But at some point, again, technologies, medicine came out to either manage or avoid it. So it's the hallmark of existence, that it is impossible to envisage everything that can come at you at any point in time. And it's not just in the area of medicine, even in the area of transportation, even in the area of the food that we eat, even in education. So technologies keep evolving. But some of those, the evolution may not be completely envisaged. You develop new things, new technologies around the problems that arise, at points in time as the world evolves. That's another one that we're witnessing, and we do not expect that this thing will linger for too long. You can trust that science will come out with a solution, either to, if not to eliminate it, but to mitigate it. So it's a fact of life, and we just have to accept it as it comes. In those days, it was impossible to fly from here to Europe. People were going by ship, 36 hours on the high sea. But of course, through technology, the Wright brothers, 1903, the aeroplane came and made it faster. And even the internet that we're talking about is an advantage in communication. So all these things evolve.
Is that it will come and pass us.
Yeah, it will come and go. That's what it is.
Okay. So, well, that's reassuring. Yeah. But again, the vulnerability of Africa as a continent in terms of research and development has come to the fore again. We are almost helplessly looking at our brothers in the developed world to find a solution. This now puts to question, going forward, the African states in general, even if you cannot fund individually as countries, must perhaps come together and look at the issues that when there is a global crisis, the continent itself has to begin to react as one body and having its own arsenal in terms of research and development to battle this instead of helplessly waiting for succor from other climes.
Well, I think it's just a matter of fact that we still have some disadvantages. We're still on the other side of development, and that's a fact we have to come to terms with. It is still what it is, and all we can do in the circumstance is to keep trying our best. And we can say we're relatively lucky. It hasn't really gone overboard in these parts of the world.
Except that some are drinking sanitizers.
There are all kinds of myths, all kinds of unhelpful belief systems, But I just hope that we're able to go through these and that something good comes out of the frenetic search for solution.
All right. Domestically, the increasing number of cases of coronavirus in Nigeria has necessitated more support and help from various organs of government in curbing further spread of the virus. A group known as Grassroots Mobilizers for Buhari and Oshibajo has been on house-to-house distribution of safety kits within the metropolis. Timothy Yusuf reports that this was concluded just before the lockdown of the FCT.
With this cab driver asking if the hand sanitizer is to be consumed, largely shows that even in the face of the ravaging COVID-19 pandemic, quite a lot of Nigerians are still unaware of its presence and danger it poses. It is for the likes of the cab driver that this political group embarked on desensitization.
I was surprised because I never knew that this kind of thing is going on here. So we're just passing by.
It's something that is causing a whole lot of panic in everybody's heart.
But see this one now, if we won't buy now for banners now 500 naira each one.
Organizers of this gesture believe that it is time for citizens to remain their brother's keeper.
Well, we have to do it because our grassroots, they need sanitizer because they didn't even know what is coronavirus. So we have to come out and do the awareness. It's not a death sentence. So if you have it, if you have fever or anything, just run to the nearest hospital.
Government alone cannot handle such situations. There is need for citizen partnership, citizens' involvement and inclusion, and this is what we are doing.
They commended the efforts of government and the organized private sector and some individuals who have contributed resources to the collective effort against COVID-19 pandemic. Timothy Yusuf, NT News.
Now, with about 200 million people across the length and breadth of the country, the COVID-19 pandemic has raised so many questions. And Nigerians have been reacting to presidential broadcasts as timely in terms of the lockdown. Let's hear this compilation by Ruth Aguele.
Although anxiousness and boredom characterize the shutting down of most activities, the people of neighboring Nasarawa states to the FCT have expressed confidence in the initiative rolled out by the federal government to prevent escalation of coronavirus pandemic in the country as contained in the presidential broadcast.
Because at a time like this, it's very important for leaders worldwide to come out and, of course, let the people know the true situation and what they are doing about it.
If it's one thing to release money, it's another thing. Proper monitoring of the fund released must actually be done to ensure that it is used for the purpose for which it is meant.
Meanwhile, the Buhari Media Organization has called on Nigerians to have faith in the present administration as a great number of projects have been lined up to address the challenges occasioned by the coronavirus pandemic and effort to contain its further spread. In a statement by its chairman, Niyi Akinshiju, the government has rolled out additional measures, including restructuring of the social investment programs, control of the fast-growing personnel costs by efficiency measures, provision of fiscal relief for taxpayers and key economic sectors, and tax holidays. The group stated that the decision in locking down Irish State is a global trend and urged Nigerians to ignore biased criticism of the Buhari administration in its effort to stop the spread of the coronavirus, especially by opposition. Meanwhile, the minority caucus in the Senate has commended federal government's approach towards combating the ravaging COVID-19 virus as contained in President Muhammadu Buhari's broadcast to Nigerians. In a statement by the Senate Minority Leader, Senator Yinaya Baribe, the caucus is ready to work and engage in a bipartisan manner with the presidency and is even ready to reconvene should the need arise to ensure that the country ward off the COVID-19 virus.
All right, many thanks to Doindia. Of course, Doindia actually put that together. We're hoping that we'll be true to Jos and speak with the Plateau State Governor, Simon Bakula Long. We were not able to do that, but we'll be speaking with one or two state governors, God willing, on Friday about compliance level in their states and the efforts being made to curb the spread of the virus. Before we go, let's take one more question with Dr. Very quickly. What should we be doing? We have at least initially a 14-day lockdown. Mm-hmm. What can we be doing perhaps to engage ourselves? We can just be, it's not as if it's a war situation. So what can we be doing?
Well, it's okay. Apart from the anxiety, the lockdown is what we need to do in the circumstance to prevent the spread of this disease, like we've been severally told by the experts. But at our own level, apart from the anxiety that we sometimes go through because of, the routine, monotonous lifestyle that we are now forced to engage in, it's important to just reflect. And how else can we reflect? We can reflect by engaging our minds, reading, writing, listening to the media, but to avoid overload of information, because that in itself can generate another form of stress. practice, Otherwise, we can spend the time developing ourselves, but let's not also forget to do some exercise, because it's also important. Well, we're trying to prevent health crisis. It's also okay not to bring some other kinds of crises to ourselves by, the absence of exercise, like we've been told by medics.
A lot of people have also said that this might be a good time to pick up 1 or 2 courses online. Perhaps the National Open University will collaborate with the NT for that.
Right.
Of course, politics has been moved from global to national to regional, and of course, this now, because of the lockdown, it is now right in your homes. It's domestic politics that is happening at the moment. So that has been political update for today. We urge you to respect the stay-at-home order and observe all safety and health tips to keep your family safe. As man is a political animal, we also urge you that even in the household, play your politics for the greater good. Fisai Ogunfi is my name. Thanking you for watching and hoping that you continue to stay safe and keep on watching the Nigerian Television Authority, where we give you the very best of news, reviews, previews, and interviews. Bye-bye now.
How can I prevent infection outside? When traveling distances, prioritize walking, bicycling, motorcycling, or taking your personal car. When taking public transportation, be sure to wear a mask. When in the workplace, keep a distance of 1.5 meters from anybody you must speak with. Avoid any meetings or gatherings in small, confined spaces. When eating at the same time as others, remember to keep your distance. Don't talk while eating. When shopping at places like supermarkets and shopping malls, try to go when less people are likely to be out. Try to avoid getting close to others. There will be more time for closeness in the future.
NTA, you can't beat the rich.
This is the network service of the NTA.